Introducing QUADAS-3, a tool to assess the quality of diagnostic accuracy studies. Diagnostic test accuracy studies are essential for informing clinical decisions, but not all studies are equally reliable or relevant. So how do we decide which evidence we can trust? QUADAS-3 provides a structured way to evaluate risk of bias and applicability concerns in diagnostic test accuracy studies. It's primarily designed to be used in systematic reviews. QUADAS-3 is applied in 6 phases. A single review may address more than one synthesis question. The first phase of the QUADAS-3 assessment is to specify with sufficient detail the synthesis questions that you will answer with your review. Which test is being evaluated, in which patients, and what is the target condition. Phase 2 is to define the ideal test accuracy trial that could theoretically be done to address each synthesis question. Deviations from this design have the potential to introduce bias or affect applicability. The ideal trial forms a formal part of the applicability assessment. In Phase 3, reviewers should draw a flow diagram for the study. This shows how participants move through the study, from eligibility to receiving the index test and reference standard to inclusion in the analysis. Flow diagrams help identify missing data, exclusions, and potential sources of bias. QUADAS-3 focuses on individual estimates of accuracy, such as sensitivity and specificity, not just the study as a whole as we did for QUADAS-2. In Phase 4, we identify the accuracy estimates to assess for risk of bias and concerns regarding applicability. Phase 5 is the core assessment. Risk of bias and applicability are evaluated across 4 domains: participants, index test, target condition, and analysis. Each domain includes signaling questions to help assess risk of bias. Within each domain, you are also asked to provide the rationale for your judgment. Phase 6 is to make overall judgments for each paired set of accuracy estimates. These summarize the key strengths and limitations of each set of estimates from each study. Not all phases of the QUADAS-3 assessment need to be performed for each set of estimates. Phases 1 and 2 are conducted at the review level, so only need to be completed once per review. Phases 3 and 4 are completed once for each study, while phases 5 and 6 are completed for each set of estimates. QUADAS-3 provides a clear, structured approach to evaluating diagnostic evidence, improving transparency, consistency, and clinical relevance. Learn more at www.quadas.info, where you can find the latest version of the tool, full guidance document, worked examples, and additional training videos.